warnings, maintenance, cleaning and disinfecting, and packaging returning devices. Oxygen-related warnings. When the device is used in conjunction with oxygen, please pay attention to the following. Once connected to a flow meter and oxygen source, set the device to run before increasing the flow of oxygen. Always adjust the flow meter slowly. Increasing oxygen flow too quickly can cause damage. Refer to page 2 of the laminated quick guide hanging on the trolley for oxygen concentration mixture guideline. Make sure that the oxygen supply is always turned off when the machine is not operating. Inspect the oxygen tube and ensure it is free of folds or kinks. Keep device away from sources of ignition and open flames. Do not smoke near the device. Oxygen supply shall be standard dry and clean compressed oxygen for medical applications, with a minimum oxygen concentration of 99.5%. Shut off the oxygen supply before turning off the device. The device will not allow shutdown if the internal FiO2 level is 25% or greater. A warning message will appear in that case. Oxygen leakage may cause serious accidents. If an oxygen leak is discovered, shut off the supply of oxygen and contact authorized personnel for repair. Contact Vincent Medical or an authorized Vincent Medical distributor for questions or service. For more information, please visit inspired-medical.com/support. Water chamber usage warnings. Disconnect water supply when machine is not running. Use sterile water indicated for inhalation only. Never attempt to manually fill the water chamber. Do not allow chamber to fill beyond indicated maximum water level. If water level exceeds the maximum level, or chamber leakage is observed, replace the chamber with a new one. Ensure the device is positioned upright. Do not tilt or store the device at an angle. Doing so may allow water to enter breathing circuit or backflow into machine. Take care not to spill water from the chamber during removal. To avoid burns, do not touch bottom of chamber. Water bag related warnings. Attach the sterile water bag to a hanging bracket at least 26 centimeters, 10 inches above the unit. Push the bag spike into fitting of the bag and make sure to open the pressure release valve. The auto-feed humidification chamber will automatically fill to the required level and maintain at that level until the water bag is empty. Only use sterile water for inhalation. Never use tap water or saline. Daily maintenance of Inspired O2FLO consumables. Use a new filter for each patient. In single patient cases, do not use the same filter for more than 30 days. Change water chamber, breathing circuit and nasal cannulas every 14 days. Water chamber and breathing circuit are non-sterile single-patient devices designed for single use only. Do not reuse. Reusing the water chamber and breathing circuit can result in cross-infection. Returning devices, cleaning and packaging guidelines. Device and 6-pin connector must be wiped down with 75% IPA wipes or 75% IPA spray. Spray a paper towel with an adequate amount of IPA and then wipe the device down. Used nasal cannula, chamber, circuit and 6-pin integrated cable discard if not part of the complaint. All parts to be returned must be wiped down with 75% IPA. Packaging guidelines. Wrap in 1 cm thick bubble wrap before packaging the device back into a carton box if original carrier bag is unavailable. Pack the carrying case or bubble-wrapped device securely in a cardboard box. Ensure that device is adequately protected before transport. Each device comes with a 2-year warranty for all out-of-the-box and manufacturing defects. Returning devices must be in good working condition, apart from the defects in question to be covered in warranty. The warranty does not cover defects or malfunction caused by misuse, abuse, or improper maintenance.